Welcome to the deep dive. This is where we, take a stack of sources you send us and really dig in, pull out the key insights. Basically, it's your shortcut to getting up to speed on something important, hopefully with a few surprises too. Today, we're diving into something really vital for your health, particularly for men. Early warning signs of cancer. We've got an article here focusing on 10 specific symptoms. It touches on the big ones like prostate, lung, and colorectal cancers. So our mission today, unpack these 10 signs from the article, figure out what they might mean, and really stress why knowing this stuff matters for you.
Absolutely. And that focus on knowing the signs as well, it's crucial. The source really hammers home that catching cancer early, it just makes a massive difference in outcomes. It does mention diet helps, sure, but it also points out that genetics can be a really big factor too.
Okay, right. Let's get into it. The source kicks off by noting cancer is a leading cause of death for adult men in the U.S. It's quite a statistic.
It really is, and it underscores the whole point, doesn't it? Knowing these early signs gives you, a much better shot at getting treatment earlier. And the source draws a pretty stark contrast. Early treatment often means better outcomes, maybe even remission. But cancer, that spread, that gets much, much harder to treat effectively, according to the article.
Makes sense. So with that weight behind it, let's jump into these 10 specific early symptoms for men that our source material highlights. First up, the article talks about changes in bowel habits. Now, that sounds like it could cover a lot of ground. What specifically are they flagging?
Yeah, it could be broad, but the source gets specific. It points to things like sudden diarrhea that doesn't go away, or the opposite, frequent constipation. And also, interestingly, changes in the actual size or caliber of your bowel movements, those kinds of changes. The article links them to potential colorectal cancer. That's colon and rectal. Oh, and it adds that sometimes frequent abdominal pain can kind of go along with these changes, too.
Okay, got it. Specific changes to watch for. And the second symptom listed is, well, it's related, rectal bleeding.
Yes, exactly. And this is one the source really emphasizes shouldn't be brushed off. Persistent bleeding, or if it's bad enough to cause iron deficiency anemia, or even just noticing blood in your stool, these are highlighted as potential early signs of rectal cancer. But, and this is vital, the article is super clear, common things like hemorrhoids cause bleeding too, right? But you absolutely cannot self-diagnose. You've got to talk to a doctor.
Right. Don't guess.
Precisely. And it also throws in that reminder about recommended colon cancer screening, usually starting around age 50.
Okay. Shifting focus a bit now, the third symptom of the source is about urinary changes. It does say some changes are normal with age, but certain ones might point towards prostate cancer.
That's right. The source flags specific things here. Urine leakage, incontinence, having trouble starting to urinate, or even feeling the urge but not being able to go. Also straining when you urinate. The article does note that prostate cancer is most common in men 60 and older, so these signs are especially relevant for that group.
And symptom number 4 listed is blood in the urine.
Yeah, this is a pretty significant one, according to the source. It's noted as a common symptom of bladder cancer. And the article makes a point of saying bladder cancer is more common in smokers, current and former.
Okay.
But it also clarifies, blood in the urine isn't only bladder cancer. It could be prostate inflammation, maybe prostate cancer itself, even a UTI. And here's a really specific detail from the source sometimes. Early prostate cancer can cause blood in semen too.
Huh. Interesting.
Yeah. But the absolute bottom line from the article on this one, simple. Never ignore blood in your urine. See a doctor.
Right. Gotcha. Okay. Moving to number 5. Persistent back pain. Now, lots of people get back pain. How does the source tell us to differentiate the worrying kind from, just a regular sore back?
Yeah, that's a really important distinction the source makes. Because back pain is so common, right? But the article explains that persistent back pain can be a symptom if the cancer has actually spread. Specifically, it mentions spreading to the bones. The example given is prostate cancer spreading to bones in the hip or lower back. And the description of the pain is key. It's described as tenderness, discomfort in the bones themselves, different from muscle ache.
Okay, so it's a bone pain, not muscle pain. That's a crucial difference.
Exactly. According to the source, that's the thing to potentially watch for.
All right. Symptom 6 is an unusual cough. And the source says this isn't just for smokers or when you've got a cold.
That's right. The article points to a persistent cough, one that kind of lingers and isn't clearly linked to a virus or infection like a cold or allergies. Especially, it says, if you don't have other typical symptoms like congestion or a fever, that's flagged as a potential early sign of lung cancer. And it adds a very specific, worrying detail. A cough that brings up bloody mucus is also strongly linked to lung cancer in men, according to the material.
Okay, good to know. Symptom 7, testicular lumps.
Yeah, the article mentions testicular cancer isn't as common as, say, prostate, lung, or colon cancer, but it really stresses that early symptoms shouldn't be ignored. And the main symptom, lumps, finding a lump in the testicles. The source says doctors usually check during exams, but it really recommends monthly self-exams.
Yeah.
That's the best way for you to potentially catch any changes super early.
Right, made sense. Okay, now we're getting into some more sort of systemic signs.
Mhm.
Symptom 8 is excessive fatigue. Feels like the body just saying something's wrong.
It really can be. The source explains it like as cancer cells grow and use up resources, the body can feel generally run down. This leads to fatigue that's more than just being tired after a busy day. It's excessive. And the article notes it's actually a common symptom across many different types of cancer.
So it's quite non-specific then.
It can be, yes. Which is why the advice from the source is, if you have fatigue that feels excessive and it doesn't get better with rest or sleep, that's a reason to talk to your doctor.
Okay. Then symptom 9, unexplained weight loss. Losing weight might sound good to some people, but the source flags this as a warning.
Definitely. And it's specific again. It's about sudden, significant weight loss when you haven't changed your diet, haven't started exercising more. It just happens. That kind of rapid, unexplained weight loss, the article says, can signal a serious health issue, and that includes most types of cancer. So the advice is clear. Losing weight quickly without trying, discuss it with your doctor.
Absolutely. Okay. Last one on the sources list, number 10. Lumps in the breast area. And the article points out this isn't just a concern for women.
Exactly. This is a really crucial point the source makes for men. You also need to be aware and check for any suspicious lumps in the breast tissue. The source identifies a lump as the earliest detectable symptom of male breast cancer, and the instruction is very direct. Find a lump, call your doctor right away for testing.
Does it mention why this might happen in men?
It lists a few potential factors mentioned in the source. Genetics, maybe past radiation exposure, or having high estrogen levels. It also notes that these lumps seem to be more common in men in their 60s.
Okay. So we've covered the 10 symptoms from the source. What's the big picture message the article wants us to take away from all this?
Well, the main takeaway seems to be that, yeah, a lot of cancers are tricky to spot early on. That's true. But some do give off these kinds of noticeable signs.
And the key piece of advice then
Is that understanding these common symptoms is really vital. It could lead to a quicker diagnosis. And the source wraps it up with a kind of golden rule. The exact signs can vary, definitely, person to person, cancer to cancer. But if you suspect something isn't right with your body, always go see a doctor. Don't wait.
So there we have it. 10 potential early cancer warning signs for men pulled straight from the source material we explored today. Knowing these, as the article stresses, really could empower you to catch something early. And that's just hugely important. And the refrain we heard again and again from the source, see a medical professional about any persistent or worrying changes.
Absolutely. Early detection is just so key for treatment success. That point came through loud and clear in the source. And as it noted, while these are common signs, how they show up can really differ.
Right. Which leads us nicely into our final thought for you, drawing on that nuance in the source. Since symptoms can vary and the source tells you to act if you suspect something's wrong, what does it really mean to truly listen to your body? To be your own best health advocate when the signs might be subtle or different from the textbook examples? Something to think about.